Sarah had always been known as a calm, collected person among her friends and family. She worked as a librarian, enjoyed quiet evenings reading, and rarely raised her voice. However, beneath this serene exterior lurked something far more turbulent than anyone could have imagined. What Sarah didn't realize was that she was living with intermittent explosive disorder, a condition that would eventually change her understanding of herself and challenge everything she thought she knew about anger management. Intermittent explosive disorder, commonly abbreviated as IED, is a behavioral disorder characterized by repeated episodes of impulsive, aggressive, or violent behavior that are disproportionate to the situation at hand. Unlike typical anger responses that most people experience, IED involves sudden, intense outbursts that seem to come from nowhere, leaving both the individual and those around them shocked and confused. These episodes are not premeditated or planned. Instead, they represent a complete loss of control that can last anywhere from a few minutes to several hours. The first sign that something was different about Sarah's anger responses occurred during what should have been a routine day at work. A patron had accidentally knocked over a small display of books, and instead of her usual patient understanding, Sarah exploded into a rage that was completely out of proportion to the minor incident. She found herself screaming, throwing books, and feeling an overwhelming urge to physically lash out. The intensity of her reaction frightened everyone present, including herself. After the episode subsided, Sarah was left feeling embarrassed, confused, and deeply ashamed of her behavior. Understanding intermittent explosive disorder requires recognizing that it goes far beyond ordinary anger or irritability. The disorder is classified as an impulse control disorder in the Diagnostic and Statistical Manual of Mental Disorders, and it affects approximately 2.7% of adults in the United States at some point in their lives. What makes IED particularly challenging is that the explosive episodes are recurrent and cause significant distress or impairment in social, occupational, or other important areas of functioning. The outbursts are typically triggered by minor provocations that would not normally elicit such an extreme response from most individuals. The neurobiological underpinnings of intermittent explosive disorder involve complex interactions between various brain regions, particularly those responsible for impulse control, emotional regulation, and aggression. Research has shown that individuals with IED often have abnormalities in the prefrontal cortex, the brain region responsible for executive functioning and impulse control. Additionally, there may be alterations in serotonin levels, a neurotransmitter crucial for mood regulation. These biological factors, combined with environmental triggers and psychological stressors, create the perfect storm for explosive episodes to occur. Sarah's journey toward understanding her condition began when her supervisor at the library suggested she seek professional help following several concerning incidents. Initially, Sarah was resistant to the idea that her anger was abnormal, attributing her outbursts to stress from work and personal relationships. However, as the episodes became more frequent and intense, she realized that her reactions were not typical responses to everyday frustrations. The turning point came when she had an explosive episode at her nephew's birthday party, terrifying the children and causing lasting damage to family relationships. The diagnostic process for intermittent explosive disorder involves careful evaluation by mental health professionals who must rule out other potential causes of aggressive behavior. Clinicians look for specific criteria, including recurrent behavioral outbursts representing a failure to control aggressive impulses, the magnitude of aggressiveness being grossly out of proportion to the provocation, and the episodes causing significant distress or impairment in functioning. It's important to distinguish IED from other conditions such as bipolar disorder, antisocial personality disorder, or substance-induced aggressive behavior. Treatment for intermittent explosive disorder typically involves a combination of psychotherapy and medication management. Cognitive behavioral therapy has shown particular promise in helping individuals identify triggers, develop coping strategies, and learn anger management techniques. Through therapy, Sarah learned to recognize the early warning signs of an impending episode, such as increased heart rate, muscle tension, and racing thoughts. She practiced relaxation techniques, deep breathing exercises, and cognitive restructuring to challenge the thoughts that typically preceded her explosive outbursts. Medication can also play a crucial role in managing intermittent explosive disorder. Selective serotonin reuptake inhibitors have been found effective in reducing the frequency and intensity of explosive episodes in many patients. Mood stabilizers and anticonvulsants may also be prescribed, particularly for individuals who don't respond well to traditional antidepressants. Sarah's psychiatrist prescribed a combination of medications that helped stabilize her mood and reduce her impulsivity, making it easier for her to implement the coping strategies she learned in therapy. The impact of intermittent explosive disorder extends far beyond the individual experiencing the condition. Family members, friends, colleagues, and even strangers can be affected by the unpredictable nature of explosive episodes. Relationships often suffer as loved ones struggle to understand why someone they care about can suddenly become aggressive or violent without apparent reason. Children in families affected by IED may develop anxiety, depression, or behavioral problems of their own as they learn to navigate an unpredictable emotional environment. Recovery from intermittent explosive disorder is possible, but it requires commitment, patience, and often long-term management. Sarah's journey involved not only learning to control her explosive episodes, but also rebuilding relationships that had been damaged by her condition. She had to make amends with family members, colleagues, and friends who had been hurt or frightened by her outbursts. This process required humility, persistence, and a willingness to accept responsibility for her actions while also acknowledging that her condition was a legitimate medical issue requiring treatment. Prevention strategies for managing intermittent explosive disorder include identifying and avoiding known triggers when possible, maintaining regular sleep schedules, exercising regularly, and practicing stress reduction techniques. Sarah discovered that certain situations, such as crowded spaces or time pressure, were more likely to trigger her episodes. By recognizing these patterns, she could either avoid problematic situations or prepare herself with additional coping strategies when avoidance wasn't possible. The importance of education and awareness about intermittent explosive disorder cannot be overstated. Many individuals with the condition go undiagnosed for years, attributing their explosive episodes to character flaws or moral failings rather than recognizing them as symptoms of a treatable medical condition. Reducing stigma and increasing understanding of IED can help more people seek appropriate treatment and support. Today, Sarah continues to manage her intermittent explosive disorder through ongoing therapy, medication compliance, and the implementation of healthy coping strategies. While she still experiences occasional episodes, they are far less frequent and intense than before she sought treatment. Her story serves as a reminder that with proper diagnosis, treatment, and support, individuals with intermittent explosive disorder can learn to manage their condition and rebuild their lives. Understanding that explosive anger can be a symptom of an underlying disorder rather than a character flaw is the first step toward healing and recovery for many people struggling with this challenging condition.